bienvenue dans Topik Konversasyon. Pareil, moi, Tinzi, puis bonnet. Dans Topik, aujourd'hui, nous causons la santé. Pareil, de mardi, nous fait. Et aujourd'hui, nous pour tous inciser qui beaucoup nous pas trop connaît, ou soit nous pas trop cause de là, mais y arriver avec nous quand nous gagnons un peu qui ça qu'on appelle 10 cahiers et nous pour cause aujourd'hui nous cause hemophilia et li pareil on dit il y a conditions qui où le corps il manquait certains facteurs qui fait 10 cahiers et ça il y a un résultat il fait ou gagne bon saignement alors si nous pas bon ça ciser aujourd'hui qu'on est le temps qu'on on est ou le corps il y a ça bon petit blé pareil nous dit partout 10 cahiers on demande quoi qui fait ça. Quoi qui cause ça? Est-ce qu'il y a un traitement? Aujourd'hui, dans Topik Konversasyon, forme partie de la conversation, demande-nous une question. Et pour un qui pour en anglais, mais seulement, si on envoie une question que on m'a translate, et Dr. Dayelin, qui nous joint moi là, il est capable de répondre aux questions, et moi aussi, je vais faire nous faire translation, créole anglais. Si on envoie une question en anglais, bon même, envoyer le créole, ma translate à cause de il pour cause en anglais. C'est là, forme partie de la conversation, là, bon matin, et faire au confortable. Dr. Dayelin, good morning.
Good morning, Raro. How are you?
How are you?
I'm okay, and you?
I'm good, good. I'm to understand you are the only hematologist at the Ministry of Health?
Yes, of course. Yes.
How long have you been in Seychelles?
Well, I arrived in Seychelles 2018, October 2018. It's almost 4 years.
Almost 4 years now.
Almost 4 years now.
Okay, so we are talking about hemophilia, which is a condition that inherited bleeding disorder in which the blood does not clot properly, right?
Yes, it's correct.
Mm-hmm.
So
what causes that?
the cause of hemophilia, how do you say, is hereditary. So it's the genetic hereditary condition that affects the X chromosome, and that's why the people suffer one hematological condition that is a deficiency in one factor of the coagulation system, and for this reason the people bleed more than another people that not suffer the same condition.
Is the bleeding common or continuously?
It depends. The more frequently is that the people present hemarthrosis, so it's bleeds inside the joints. It's the more frequently. It's not frequently that the people bleed outside.
So tell me, does people develop hemophilia in their diet or their lifestyle, or is it inherited?
No, it's hereditary.
It's inherited?
Yes, it's inherent and is secondary to deficiency of factor A or factor 9. For the reason is hemophilia A or hemophilia B. And is when is the mother that is the carrier of the hemophilia, and the son will get the disease. It's the male that will suffer the disease. The female is not
so
suffer.
You are at high risk to get hemophilia if there is already in the family?
Yes. If the mother have the condition, the genetic condition that is the mutation in one chromosome, and is the mother that is carrier of this type of the disease, the son will get the chromosome X of the mother, from the mother, and will present the disease. If the boy have if the boy have get the chromosome X from the mother and the chromosome G from the father, for this reason the chromosome affect is the X that is from the mother, and the boy will present the disease. If for the reason that is the symptomatic.
Possible symptoms or signs of it?
Yes. For example, when is the newborn can present umbilical bleeding from the cordon umbilical bleeding, hematoma, ecchymosis, hemorrhage, head hemorrhage. Also, when the child start to grow, can present hematoma in the joint, the neck, in the head, in the shoulder, in the elbow is the more frequently, and also so a hematoma that is the more important bleeding that the people present, and the more dangerous bleeding that the people present when they present this type of condition.
How can it be diagnosed?
So the people can suspect it when it's, for example, a male, present gastrointestinal bleeding, or present some hematoma or have effect of in the elbow, cannot move the elbow start swollen, start to painful, redness. And the people going to or present another type of bleeding, the people going to do the blood test, and we can get, usually we need to do the white blood cell, platelet count, and HB. Usually in the hemophilia, the platelet count will be normal. When we do the PT, the coagulation profile, that is PT, thromboplastin time, and proton bleeding time, we will see that the thromboplastin time will be affected, will be prolonged, and we need to suspect at that time that the people is a porter or is carrier of this type of the disease, and we will confirm doing the dosification of the activity of factor A and factor 9.
Let's talk about the bleeding, doctor. If it's continuously or repetitive, it can cause or damage pain.
Yes, can produce pain, can be cause of the also ankylosing, so deformity of the of the bone. And when the people have bleed, because sometimes the people also don't feel that it's bleeding, and it's bleeding inside the joint and produce malformation of the bone.
But they don't see that.
They don't see that. They will feel like bone, like some pain, slight pain, that the joint will be affected, will be like some redness, or sometimes will be warm. Sometimes the people say, no, it's because I was fitting with something, or so was secondary to any trauma, and it's not from any trauma. It's because the people have hemophilia, and it's bleed inside.
In this case, when they are feeling like it, they have to report?
They need to check. They can go to the local clinic to check his. The first is to do the physical exam. If the doctor check and see that the patient have swollen or have redness or have some sign alarm, need to do the blood test to confirm if it's the cause or if another cause.
I can understand that there are 3 types. A, B, C?
Yes. The more common is A.
A, the more common?
Yes. On the world, around 83% of the people suffer hemophilia. The more 83% is hemophilia A. Around 15%, 17% will be hemophilia B. And it's rare, very rare, the hemophilia.
B is rare?
It's rare. So the percent is around 70%. And more rare is hemophilia C. It's very rare. And also we can see the acquired hemophilia. Acquired hemophilia.
Can it be cured?
The acquired hemophilia can be cured. No, hemophilia A or hemophilia B
or B cannot be cured?
Cannot be cured.
But C can be cured?
C also cannot be cured. A, B, and C cannot be cured. C is infrequently.
But you can go on treatment?
Yes. The people need to be treated all the time.
What is the treatment?
The treatment, it depends. So the quantity of the bleed. The hemophilia could be slight, mild, or severe. It depends on the deficiency of the factor. When the factor is the activity of the factor is deficiency less than 1%, is severe. Severe, yes. And produce a lot of bleed. The people can present a lot of complications, like so a hematoma, that is bleed inside the abdomen. And the treatment will be more frequently. If the percent is between 1 and 5%, the people will present symptoms is mild. And when it's more than 5 and 25, is slight. So the treatment usually, it depends on, so if the bleed is intensive bleed or is mild bleed. There are different treatments. So we can use before 2019. So 2019 so was only the whole blood. Now the blood wall we don't use as a treatment on hemophilia patient. the actual treatment is the factor A and factor 9. That the people, it depends. If it's hemophilia A, the people will use factor A. If it's hemophilia B, we will use factor 9. Also, another type of treatment that is factor 7, recombinant factor 7, in case that the people produce another resistance to the treatment. We can use also fresh frozen plasma that we try to avoid to use fresh frozen plasma for the other complication, the post-transfusional complication that the people can present after that. Also, the treatment include tranexamic acid, is the antifibrinolytic to avoid that the people continue bleeding. Also, the local treatment that is called compress, immobilization of the joint effect. We need to teach the people to learn with hemophilia. We need to teach them that they need to use, to avoid use intramuscular treatment, to avoid injection, to avoid treatment with aspirin, with clopidogrel, with diclofenac, black baclofen, because all this medicine can produce bleeding.
C'est celle, si vous faites nous de Topik Konversasyon, nous peut cause la condition qui appelle la hemophilia, qui est une condition qui où le corps, il manque certains facteurs qui fait ou gagne 10 ans cahier. Et docteur Dayelin, il nous a demandé là aujourd'hui, justement, pour nous cause là, et il y en a trois types en effet, A, B, C. Et pareil, il dit, il est sévère. Et si vous, de temps en temps, vous remarquez ça dans 10 ans cahier, et il y en a bon endroit quand vous grattez, il y en a ça dans saignement qui pas arrêté, vous gagnez difficultés, complications, et quand de temps en temps, vous allez continuer à arriver ça, il est capable de gagner traiter. Oui, mais il faudrait ou rapporter bonheur. Alors, si vous êtes capable de causer avec nous, la bon matin, au D88, 89, font partie de sa conversation sur l'expérience du sang cahier, sur douleur dans le bon muscle, dans le bon joint, pareil, nous dit, il saignait, on ne pas pour connaître aux escalaires, ou gagne douleur, cause avec nous, la bon matin, regardez si pas hemophilia. Doctor, does it mean that if once you have hemophilia, it's for life?
Yes, it's for life. If it's A or B.
If it's A or B, it's for life?
It's for life. If it's acquired, no.
It can be cured?
It can be cured. When you improve when you hold the cause that produce the hemophilia, the people will cure. When it's A or B, it's hereditary genetic condition that never will be cured.
So almost 4 years you're here in Seychelles now. So tell me, give me an approximately how many patients have you diagnosed with the hemophilia here in Seychelles?
Yes, we have hemophilia A, we have hemophilia B patient, and we have also acquired hemophilia patient. That is around 10 people with diagnosis of hemophilia at this moment. Around. Yeah.
Since you've been here in Seychelles?
Yeah. And before.
And before. Altogether 10?
Altogether.
Around, okay. Around. In all the blood disorder that you have diagnosed here, doctor, how frequent in this condition in Seychelles?
The other...
All your diagnosis? How frequent?
The hemophilia? The hemophilia is not like frequently like another type of disorder. So it's infrequently, so can happen. We have.
Once you get hemophilia, it's for life, depending on the type. But before you diagnose somebody with hemophilia, what are the prevention? So
before the diagnosis, and even when you give the diagnosis, the people need to prevent, is that I already told you that need to prevent the injection, the use of aspirin, clopidogrel, anticoagulation treatment is not necessary. To avoid to use drugs, alcohol, is also cause of acquired hemophilia, secondary to liver damage.
What does it do? It can complicate your lifestyle more? Or?
Complicate more and can produce also acquire.
Okay. Let's stick on the complications and the challenges of hemophilia once somebody gets it.
So, well, the people can present. So hematoma is the serious complication, is the unfrequently bleed from the people with hemophilia. So it's the more dangerous complication also that the hemophilia patient can present because it's the bleed inside the psoas muscle inside the abdomen, and sometimes it's possible that the hematoma start to bleed inside the abdomen and produce the hemoperitoneum, so bleed inside the abdomen. And the hemophilia patient, the treatment is different to another patient in different complications.
So each person is different?
Is different. For the hemophilia patient, for example, if present so a hematoma and the people need to do any surgery, need to be prepared because the hemophilia patient...
Surgery?
Yes, for a surgery treatment, need to be prepared. You cannot go into to theater to do the surgery like that without preparation because the people can bleed inside theater. And also the deformation of in the joint that produce impossibility that the people live his life with doing everything because produce ankylosing. Ankylosing is deformity in the joint and the produce limitation of the movement of the articulation.
So, what about going to the gym, doing exercises? Maybe can you do it with hemophilia?
The hemophilia patient can do some exercise. Cannot do the exercise. Cannot make the exercise. Yes, cannot make exercise that to be in contact. So can make, for example, yoga, passive exercise.
Okay, we have somebody is talking to us. I will read it in Creole, then I'll try and translate it. Okay, the person is asking if you have to come to the clinic when you get hemophilia. Is it a hereditary condition? And if you are a mother, I was coming to that point. The woman, we get our period every month. So can it treat or can it be a complication when we get hemophilia?
If it's a woman, don't have any complication.
No?
No. If the son of this woman that can get the disease, it's not a complication, it's not the disease.
And that text says, I am a mother. If a mother who have the condition and she comes for the test, and the baby, or maybe a boy or a girl, have it as well. If it's just a carrier, what about the carrier?
The carrier is asymptomatic. It's no suffer the disease. It's only carrier. Present the chromosome affect, and that's it.
So it doesn't suffer from hemophilia. It's just a carrier.
It's just a carrier.
Pour qu'un texte nous voilà docteur il explique mon translate en anglais ou texte en entier pareil on dit il pas pour souffrir il pour juste un carrière pareil on dit oui héréditaire pareil il dit si ou sa maman voilà docteur il envoie son la réponse mais si ou pas encore assurer on veut la réponse précise ce serait texte moi et n'a va essayer couvert ou question et docteur essaye répondre qui moyen est capable. Here in Seychelles, do you think, in your own opinion, in your own words, do you think we have much or we need more on to learn on hemophilia? Is there that education?
I think that we can learn a bit more about hemophilia, how to live with hemophilia, how to...
Does the people know about hemophilia?
Hemophilia is the rare disorder. Maybe for that's why that the people don't know.
They don't know because it's just like a disorder. They see a little scratch, a little blood clot, maybe days come and go.
Yes, I think that is they need to learn a bit about hemophilia, when the people get the hemophilia, when it's hemophilia patient, how to live with the hemophilia, because the hemophilia is the produce limitation of the life. It's not here in Seychelles only, it's in all world. So the people need to learn how to live with hemophilia.
But what is the ministry doing for it?
Well, we have the SOPD follow, where we see the hemophilia patient, when we try to educate the patient, we have the treatment for the patient.
E les moun qui nous texte nous en créole ou pas besoin les di moun vinn kotou pour hémophilia. OK, il y a une condition héréditaire, alors les mamans ils gagnent sa condition. Docteur, il y en a pour faire test loin garçon à cause si fille is a carrière, mais il pas souffert from the disease. Merci pour le texte, c'est ça qui docteur il a expliqué. What is the situation, the actual situation here in Seychelles?
The actual situation, we have some people with hemophilia A, with the hemophilia B, some people with acquired hemophilia that fortunately till now all those people are controlled with treatment and follow-up.
We have another text. I was coming to this. Thank you for your text. We are now taking this text. Bonjour. Said bonjour.
Bonjour.
Doctor said bonjour. Can this condition be fatal? Will the person be anemic? Is the blood contaminated? 3 questions in one text. Let's take the first question. Can this condition be fatal?
It depends.
Depends.
Yes.
On what?
It depends which type of bleeding the people will have. If it's so a hematoma, could be seriously. If
Can
it's
lead to death.
can live, so can present also could present a lot of complications during the hematoma. Usually, the hematoma is abscess. In normal people, when the people get the abscess, you can do the surgery in the abscess to cure the abscess. In hemophilia patient, we cannot do the surgery only if it compromises the life of the patient. And the people need to use antibiotics for a long time and also to use the factor A to try to obtain the reabsorption of this hematoma.
The next question, will the person be anemic? Yeah.
Well, if the person is anemic, I advise that do the investigation why is anemic. Because if it's
But will you know if the person is anemic?
well, if it's a hemophilic patient, no hemophilic patient, we will know if he has anemia, which type of anemia the people has. So, if it's the person that is we don't know that is a case of hemophilia patient is newly diagnosed, we need to investigate the cause of anemia, because the anemia could be secondary to the secondary to frequently bleeding of the patient, could be secondary to another hematological disorder, could be, because anemia also is the topic that have different cause, and it's not frequently that you see the hemophilic patient only if it's a hematoma or is symptomatic patient, usually don't have anemia.
Don't have anemia.
No.
And the next question in the text, is the blood contaminated?
Well, when means blood contaminated means that if the people can give blood to it's not that the blood is contaminated, it's that the blood have deficiency in one factor, the important factor to avoid that the people bleed. No produce clot. So it's not contaminated.
Ok, voilà, ou qui n'envoie le texte, mon supposé docteur, il répond tous les 3 aux questions qui sont dans un seul texte. Nous prenons l'autre. This one is talking about scratches. They see a little blood clot or maybe just a hint, like a limb, just a kiss. They start scratching it and it bleeds, never stops.
Well,
Continuous bleeding.
When it's scratch, so it's not frequently hemophilic patient with scratch. It's more frequently with hematoma in the joint.
In the joint.
When have scratch, we need to rule out another cause of
This is something else?
of coagulation disorder. Hemophilia is not the only coagulation disorder that we have. We have a lot of coagulation disorder that, for example, the thrombocytopenia or thrombopathy can produce scars more frequently than hemophilia. So anyway, I advise to do the white blood cell and to do the coagulation profile.
Now, the big question is that the actual situation, it's more than 2 years since we have been living with COVID-19. And this is very, very severe. Once you've contracted COVID-19 and you are a hemophilic person, well, this is complication. What do you do?
No, it's not like the complication, because the COVID produces another type of complication that is clot, and the hemophilic patient is the disorder, the coagulation disorder that the people have is to avoid that the people clot. So it's no keep relation between the complication from COVID with hemophilic patient.
It can complicate your health.
Can be no keep relation with complication with hemophilic patient. COVID don't have keep relation.
Okay. Another text from our viewers. Thank you so much. Not everyone will get hemophilia. It's only hereditary. So all women who are hemophiliacs should be screened when they are pregnant, and the boy, when it is born, should be properly followed up by the ministry.
Yes, of course.
What do you say?
Well, when we detect that the baby, if it's newborn and start to bleeding, we check the baby from that the born. So, and we send the blood abroad to do the factor A and factor 9 to confirm the diagnosis. And if the woman knows that she is hemophilia, we need to know, she need to tell us that she's carrier of hemophilia, because she's not suffer the disease. She's carrier of hemophilia, and to continue follow up.
And then you have to see which type it is.
Yes, because the treatment is different.
For each type?
For hemophilia E, the treatment is factor A. For hemophilia B, is the factor 9. And if the patient have inhibitor, the person have inhibitor, we need to increase the dose of the factor, or to use factor 7 recombinant.
So once you have been diagnosed with hemophilia, does it mean that there is restriction on your lifestyle?
Yes. Have limitation. You can continue.
And limitation?
Yes. You can continue live your normal life with limitation. You cannot practice sport like maybe before you was
heavy duty sports.
No, cannot do. Need to avoid to do job that can produce issue in yourself, like court, because if the person with hemophilia court anywhere, we will bleed a lot. So
there is mild and intermediate or severe. So which one of the three would you stop doing it if you are at work or doing exercise?
The three.
The three.
The three.
No.
Yes.
No limitation. The three.
The three. The three need to live with limitation. For the reason that I told you, that they need to learn how to live with hemophilia. They can do the normal life with limitation.
Apart from the muscle joint and everything inside, how does a person know they have hemophilia?
So only for the bleeding, could be gums bleeding, could be gastrointestinal bleeding, rectal bleeding, or only for bleeding, or that the people during the checkup, the doctor do the coagulation profile and detect that the coagulation profile is prolonged, and we need to do the investigation to confirm.
The blood contains many proteins. We can say many proteins called clotting factors that can help to stop the bleeding.
And it's the factor A and factor 9 is one of these. The coagulation system is complicated, have different coagulation factor. Our coagulation factor A, factor 9, that is producing the hemophilia, factor 7, vitamin K, factor von Willebrand, that produce also other type of coagulation disorder. When one of these coagulation are in deficiency and is hereditary, the people will get one coagulation disorder. In case of hemophilia, it's because the coagulation, the factor A is that is low. The activity of this factor is low.
Can you deal with that if it's low?
Sorry?
Can you deal with that if it's low?
Yes. Yes. And for this reason, it's mild, slight, or severe hemophilia.
Anyway, doctor, anything you want to add on hemophilia? And Hemophilia Day was on the 17th of April, on Easter Day.
Yes, it was yesterday. And this day is the World Foundation of Hemophilia proclaimed the World Hemophilia Day in commemoration of the founder of the World Hemophilia Foundation, Franz Nabel. And in this day, usually in our country, is the Hemophilia Day when they have some activity to teach the hemophilia patient to live with hemophilia, teach about the new possible treatment of the hemophilia, because our different treatment that also is novel therapeutic that is under investigation to help to live the people with hemophilia.
Someone is texting us and they said very little people have hemophilia in Seychelles, and nearly everyone who has it knows they have it. We are a very small country. The management is very easy. Let's talk about the management. The text said that the management is very easy. Would you agree with that?
No, not really.
Not really?
Not all the time is easy. It depends. It is like, sometimes the people think that this easy treatment is not like that. It depends on the bleeding of the people. It depends on the place where the people is bleeding. It depends on the complication that the people have. It depends if the person not present any inhibitor of the factor, because some person produce, when use a lot of, when the hemophilia patient use a lot of factor A, necessary factor A or factor 9, it depends if it's hemophilia A or if it's hemophilia B, they will get one condition that is inhibitor of this factor, and the treatment is not improve the condition of the patient, and it's necessary to use another therapeutic, and sometimes it's not easy to improve the people.
Voilà, ou kin text nous, kin dit nous, the management is very easy à cause du système dans un petit pays. Mais docteur, il corrige là, il dit pas tout à fait pareil ou peu quoi, il est peu difficile pour manager même si nous un petit pays. Dr. Dayelin, last message, key message for our viewers or our patients living with hemophilia?
For our hemophilia patient, that to stay, to try to do all the that they know that they need to do, because in the SOPD we talk about how they need to live, to try to use the factor coagulation only when it's necessary, to try to do the exercise that they can do, to try to avoid the complications of hemophilia, and to try to live happy, even that present this type of condition that is for all their life. So it's no, the life is nice. So they need to learn.
Live the life.
Yes, they need to learn to live the life like this.
Dr. Dayelin, so many thanks for today's topic conversation on Bonjour Cécile. Thank you, and do have a blessed and nice day today. I know that this is not easy. You are the only hematologist in the Ministry of Seychelles working on hemophilia and other related conditions like. But do have a blessed day today and blessed continuation.
Same to you, and nice day, and thank you so much for to invite us to talk about this important topic.
Yes,
that
it
I
is
know.
important. We
Yes,
don't talk that much on it.
Yes, it's very important. I know that all the hemophilia patients that I know that we have, they will be very happy to talk about this topic, and also the people that will present any symptom, they will check, and they will be very happy also to know about this condition. Thank you so much, Carol, for your invitation, and we will
Absolute pleasure, Dr. Dayelin.
Thank you so much, and we will to continue doing everything our best for all Seychelles people.
Thank you so much, Cécile. Nous sommes cause lo 10 cahier ou bien hémophilia en anglais. Pareil, on tin voit là bon matin, pas beaucoup nous qui cause là, et pas beaucoup de monde qui gagne, mais seulement nécessaire qui nous cause là. Pareil, docteur dit si un patient hémophilia, vivez la vie, même si là, vivez la vie. Il y a quelque chose qui restricte, bien sûr, là où gagne hémophilia, mais seulement vivez la vie and always be happy. Prends-les positive. Ça, c'est notre topic conversation.